Hi, I'm Dan Wager,
And I'm Dan Clark.
and we did our presentation on sports hernias. The most common definition found throughout most of the literature for a sports hernia, which is also known as athletic pubalgia, is the weakening of tendons or muscles of the lower abdominal wall or groin area without an actual palpable herniation or deformity. Here listed are just some muscles and tendons involved. The main ones that you want to be concerned about are the adductor brevis, the adductor longus, the gracilis, the pectineus, and the rectus abdominis. So basically anything that's going to cross along that pubic crest right around the pubic symphysis, which is another cause for concern sometimes. Also, the inguinal ligament is a place that you might find some irritation.
For some general information, one of the first talked about cases of sports hernia was in 1980, and it was called Gilmore's groin. Multiple other names for sports hernia include slapshot gut, sportsman's hernia, hockey groin syndrome, and core muscle injury. It is still not fully determined what structures actually cause the groin pain due to multiple muscles and ligaments attaching to this area.
Here are some signs and symptoms of sports hernia. This can either be a chronic injury or have an acute mechanism of injury that can be extremely painful. It's possibly called sports hernia because the literature states that sports movements increase the pain. So an example of that would be a trunk rotation with flexion while in single leg stance. So kicking a soccer ball or turning on your ice skate, anything that's going to cause that twisting of the trunk while on single leg. It's also often difficult to pinpoint in athletes because of the referral of pain usually goes to the entire groin area. And exertion that increases intra-abdominal pressure also increases the pain. So coughing, sneezing, or bearing down. Sports hernias tend to have no visual abnormalities or palpable deformities. However, it will be tender at touch, so a palpable tenderness will be absent or present. I'm sorry. Also, pain with hip abduction, flexion, and pain with sit-ups are a good way to test for a positive sports hernia. Here I just put some exercises if you want to take the conservative route for core strengthening. The picture of me on the right on the top is a plank with a bird dog, so that's just really increasing that core stability. And you also have the picture on the bottom, which is a plank with a single leg lift on a Swiss ball. You can also do more beginners core stability, so posterior pelvic tilts, and you're just going to tilt the pelvis backwards and strengthen the core by like isometrically tightening up. Here are some short-term goals or protocols as brought on by the literature. These are for post-operative if you were to go that route. Week 1, you want to only stick to activities of daily living with no heavy lifting. You can be full weight bearing, but only on flat surfaces. And use for modalities such as ice and stim are a great way to keep the pain down. And you want to be conscious of the wound and take care of that. You can also do some light hip and abdominal isometrics. When you move into week 2 and 3, light exercises in the pool begin to increase. And you also can do closed chain standing balance to activate core muscles. Hip adduction, abduction, flexion, and extension against gravity are also permitted in this stretch of weeks. And you can also start stretching, but real lightly. This is also a good time to bring in a stationary bike without any resistance, though. Here are some long-term goals or protocols. Week 4, your running progression starts to progress from a light jog to a speed running at 75%. You can begin to lunge and step up to activate the hip flexor muscles. You want to make sure you keep the hip flexion under 60 degrees though. And you can also start on this week a deep tissue massage over the surgical area to break up scar tissue. You can also strengthen external and internal rotators at this point and begin core strengthening against resistance. Weeks 5 and 6, you want to balance on unstable surfaces such as single leg stance with ball toss or single leg stance with deadlifts. progressive resistance exercises, strength hip adductors, abdominal progression to advanced exercises such as planks, and you can also begin weight training of all extremities, so lower and upper. From week 6 on, this is when you're going to add weights and or bands for progressive resistance exercises for adduction. You can also bring in cardio for 20 to 30 minutes to really ramp up the aerobic exercising. So bike, running, swimming, all those things are good for this injury. You can also begin sprinting, so forwards, backwards, shuffling side to side, and also karaoke are good exercise at this point. And then dynamic core and pelvic exercises incorporated, such as kettlebell swings and functional movements like burpees, are a good determinant of return to play status. And here are some exercises, more exercises that I included. On the left, you have Dan doing a single leg stance deadlift. On the right, I have me doing a Russian twist on an unstable service. And then also on the bottom is a jackknife, or some people call it a reverse crunch on a Swiss ball.
Next, we will be talking about the difference between a conservative and surgical treatment of sports hernia. Majority of the literature presented that earlier surgical treatment is the most effective. In a case study that I'm going to talk about next, it stated that only one previous case of conservative management was successful in returning a professional athlete to their sport, but it has been determined that a completion of physical therapy before surgical treatment will help increase the better outcome of long term. First off, with the case study of conservative management, we have a professional golfer with lower abdominal and growing pain after increasing his conditioning regimen. Patient reported pain with swinging his driver, planks, pull-ups, push-ups, and sitting up in bed. Initial examination presented with many different diagnoses, but due to the location of pain and mechanism of injury, a provisional diagnosis of sports hernia was determined. The physician agreed with these findings and had the patient complete 2 weeks of physical therapy in order to determine if surgery was needed. Week 1 of treatment involved basic retraining of core muscles along with exercises to increase balance and coordination. Some of these exercises included isometrics of the glute max, fundamental rolling patterns, quadruped hips extension along with alternating arm and leg, single leg squat from step, and a stationary bike. Once the athlete progressed from these initial exercises, he was able to perform resistive exercises in the same initial postural places. Some of these secondary rehab included half kneeling chop, lift patterns with cable resistance in his golf stance, single leg deadlifts, and resisted side steps. Late rehab included exercises that involved speed and plyometric activities in order to prepare him for swinging in a tournament 3 weeks away. Exercises included rotational ball throws and golf posture, lateral bounding, and single leg box jumps. After 4 weeks of therapy, athlete reported 0 out of 10 pain for golfing activities, but did report a 2 out of 10 pain for exercises that included sit-ups, pull-ups, and planks. So he was informed not to perform these exercises for another 6 weeks. Up in these pictures, you have the top left, you have the lift pattern and the golf posture. Top right, you have half kneeling balance work with uneven foam under his knee. And in the bottom, you have the supine to prone rolling, which is used to determine how well you can roll over while keeping arms and legs in unison with your core. Next, we looked at a surgical treatment. This is a minimal repair technique. It's an open suture repair, best seen for professional athletes due to not using mesh for the reinforcement of the posterior wall. This treatment involves decompression of the general branch of the general femoral nerve. One of the advantages of this treatment is that you're doubling the area of weakness in the fascia without affecting any of the surrounding tissue. It said that you never want to use the prosthetic mesh for athletes because after surgery they require the full use of their abdominal muscles.
So here are references. Thank you for listening to our presentation on sports hernias.